Obviously, the stress that I was experiencing working from home, with the job and everything, and I felt in a very dark place, not really knowing how to get out of it. And at that point felt very on my own with it, even though chatting to colleagues and they were experiencing similar feelings. It just felt there was no way out.
I was really pleased that the needs of staff was receiving long overdue recognition. It felt as if suddenly the importance of looking after people that were looking after everybody else was being recognised. And that was something that was really, really appreciated and valued by people using the hubs, that they got direct, quick access to a highly trained mental health professional. We were seeing high levels of mental health distress. So there was a huge variation in what people were coming to us with. But we were certainly seeing staff who were desperate, who felt they couldn't carry on, and who were sometimes talking about feeling suicidal and not wanting to live.
I will say to people how, the NHS saved my physical health, but the Resilience Hub saved my mental health, well and truly.
I don't know whether I would still be working in social care if I hadn't received the support from the hub. The team look at me for support. I have a responsibility to the team for their well-being, but I couldn't even look after myself.
The most common reason for sickness absence in the NHS is usually anxiety and depression or associated mental health problems. Sickness absence rates in the NHS are very high.
Really well-designed, responsive services offered at the front line to health and social care staff made a real difference, and it impacted positively on staff's well-being and also on sickness rates.
The NHS was vulnerable before COVID. Staff retention was already low, but now after COVID, we have people leaving the health service in droves.
Demand is at its height this year. So this year, throughout the year, the hub leads are reporting that the demand for these services is considerably higher than pre-pandemic levels, but what we've talked about far, far less in terms of the national conversation is the need to look after staff and to really make sure we invest in proper support services for them.
What I would say to budget holders who are weighing up spending money on staff wellbeing services as opposed to not spending the money is look at the cost of sickness absence and agency cover within the NHS.
By the nature of what NHS and social care staff do, I think for them it isn't a job, it's a vocation. I think particularly, NHS staff, and they give everything. They go above and beyond. They have long days, long nights, but that vocation in them keeps them going. And I feel we have a duty to look after them now, today and always.